In April of 1977, the Chicago Children's Hospital recorded the admission of a 10-year-old boy named David, who had a cyanotic congenital heart defect. His clinical condition had been monitored since birth, and 2 weeks earlier, he had undergone a partial corrective surgery. His recovery was progressing as expected until the afternoon of April 12th, when the nursing staff recorded a sudden cardiorespiratory arrest at 2:37 p.m. Resuscitation protocol was immediately initiated and lasted about 4 minutes, until his heart spontaneously resumed rhythm. David was then taken to the pediatric intensive care unit, where he remained on assisted ventilation for 12 hours. In the following days, he showed a good clinical response and was conscious and cooperative. 3 days after the episode, having passed the immediate risks, he spontaneously told one of the nurses something that drew attention due to the clarity and tranquility with which he described it. He said that during the period when he could no longer hear the voices of the staff, he had seen himself above his own bed, watching the doctors and the lights of the room. He also commented that he had seen people with light in their hands, who comforted him without speaking. The nurse recorded the statement in the chart and reported the episode to the hospital psychology team. The information reached Dr. Elizabeth Kübler-Ross, a Swiss psychiatrist based in the United States, known for her pioneering work on patients in critical conditions. At that time, she was conducting a survey of cases of preserved consciousness during states of clinical unconsciousness, seeking to scientifically understand how the mind reacts in extreme situations. She then decided to include David's case among those observed in her research. During the interview, conducted in a calm environment and without the presence of his parents, the doctor sought to verify the consistency of the account and possible interferences from medication or mental confusion. David was lucid, spoke slowly, and remembered precise details of the resuscitation room, such as the position of the equipment and the continuous sound of the cardiac monitor. When asked what impressed him the most, he replied that he had felt a white peace, unlike anything he had ever known, and that the luminous figures seemed to know him. Kübler-Ross noted in her observations that the boy presented a logical discourse with no signs of delirium. The subsequent electroencephalogram showed no relevant alterations. The doctor concluded that the account could not be explained only by common physiological effects of cerebral oxygen deprivation. Even so, she kept the description within the field of clinical study, avoiding interpretations of a spiritual nature. Her focus was on understanding the experience from a psychological and cognitive point of view. David's case was recorded in the hospital archives under number 312A and was periodically followed by Kübler-Ross and her team. At that time, she still did not imagine that this quiet and observant boy would become one of the clearest voices amidst the narratives of near-death experiences in childhood. In the weeks that followed the episode, David maintained a stable recovery. His physical state evolved without complications, but what caught the team's attention was not just the medical progress. Nurses and psychologists began to record small behavioral changes, subtle but consistent. The boy, previously described as anxious and reserved, now demonstrated an unusual serenity for his age. He responded calmly to blood draws, asked to greet the technicians by name, and often said that everything was fine, even when it hurt a little. Elizabeth Kübler-Ross requested regular psychological follow-up, conducted under rigorous clinical criteria. The sessions were short, carried out within the hospital itself. In the notes dated May 1977, the psychiatrist recorded that David had clear memories of the episode of unconsciousness, describing the environment with verifiable details, such as the color of the nurse's coat and the metallic sound of the instruments. At no point did he show confusion or memory alteration. During one of the conversations, Kübler-Ross asked what he thought about the figures he had seen. The boy replied naturally, "They were there so I wouldn't be alone. I knew I could stay with them, but I also knew I still had to come back." This statement was noted down in full, because it was striking due to the absence of prior religious content. David did not come from a practicing household, nor did he have consolidated spiritual references. The symbolic interpretation seemed to emerge spontaneously, without external influence. For Kübler-Ross, this was a central point. In her method, the analysis of experiences of this type required separating the perceptual content from the interpretive content. She observed that the child reported visual and auditory perceptions in a concrete way, without attributing mystical explanations to them. When he called them angels, the term came from the boy himself, but without an explicit religious connotation. For him, they were luminous, familiar beings whose main function was to transmit security. The subsequent psychological report described David as emotionally balanced, with good school performance and appropriate social behavior. There were no signs of trauma, delirium, or persistent fantasy. On the contrary, he seemed more attentive to the people around him, demonstrating empathy and patience uncommon in children hospitalized for long periods. Kübler-Ross recorded that this pattern was repeated in other cases studied. After episodes of deep unconsciousness, some patients showed positive and lasting changes in how they dealt with fear and pain. When he was discharged in June of that year, David left the hospital with outpatient follow-up and scheduled returns every 3 months. The psychiatrist requested authorization from the parents to maintain contact and assess his adaptation outside the hospital environment. Consent was granted, and the case continued to be discreetly monitored. For Kübler-Ross, the value of that account was not its novelty, but the clarity with which it showed an experience reported by a child without previous exposure to spiritual concepts. She considered David's case a rare example of a pure clinical record, in which the narrative occurred before any external interpretation. This methodological care would be one of the hallmarks of her approach over the following decades. In August 1977, 3 months after his discharge from the hospital, David returned to the outpatient clinic for his first reassessment. The consultation was accompanied by Kübler-Ross, who sought to observe not only his medical evolution, but also the psychological impact of the episode. The boy was well, had gained weight, and showed no signs of regression. Exams showed good cardiac adaptation, and his general behavior was described as calm, collaborative, and confident. During the interview, held in a private room, Kübler-Ross revisited the topic of the experience he had lived through. She asked if he still remembered what he called the hospital angels. David confirmed without hesitation that he remembered everything, but described it more briefly, saying only, "They came to help me not be afraid." When asked if he had seen them again, he replied no, and added that now he knew that people don't disappear, they just stay in another kind of light. The psychiatrist recorded that the tone of his speech was serene, without exaggerated emotion. David seemed to treat the subject naturally, as something understood and integrated into his own experience, not as an isolated memory. This characteristic piqued the researcher's interest, as in several cases studied, children's accounts tended to fragment or lose coherence over time. In David's case, the narrative maintained a stable structure without signs of increasing fantasy. Kübler-Ross then began to include the family in the observations. His mother reported that after the hospitalization, her son's behavior had changed perceptibly. She said that he was more affectionate, slept better, and rarely showed fear of exams or doctors. She also said that, in the weeks following his return home, the boy began to draw human figures with halos of light around them, explaining that that's how you see people's kindness. These family records were integrated into the psychological file and used as a reference in the longitudinal follow-up. In her notes, Kübler-Ross highlighted that such manifestations were not signs of confusion, but possible symbolic ways of expressing the emotional content of the lived experience. She observed with interest that the child had transformed the episode into a source of psychological tranquility, not fear, a rare outcome in cases of traumatic hospitalizations. During the second consultation, in November of the same year, David reported a recurring dream in which he returned to the hospital room and saw the men of light, who only waved and disappeared. The psychiatrist recorded that the dream content did not seem to generate anxiety or discomfort, being described with neutrality. The boy said that the dream made him remember to breathe slowly, like when I was there. These details were interpreted by Kübler-Ross as evidence of a healthy processing. Instead of avoiding the memory, David used it as an element of emotional stability. For the doctor, this was one of the most relevant aspects of the case. The extreme experience had not produced fear, but a new perception of security and continuity of life. The follow-up continued throughout the following year, consolidating David's case as one of the most complete among those studied by Elizabeth Kübler-Ross's team. Based on it, the psychiatrist would deepen her reflections on consciousness and emotional integration in pediatric patients subjected to critical states. In January 1978, Dr. Elizabeth Kübler-Ross gathered her research team to review the clinical material accumulated over a year of observing pediatric cases. Among the folders on the table, chart number 312A, David. His case received prominence for presenting an unusual set of data: spontaneous account, narrative coherence, emotional stability, and absence of religious or cultural factors that could influence the boy's perception. In internal meetings, the team meticulously reviewed the nursing notes, family history, and psychological reports. No indication pointed to delirium, hallucinations, or pharmacological effects capable of fully explaining the experience described. The psychiatrist maintained the same methodological care, treating the case as clinical material, without concluding beyond what the facts supported. For her, the important thing was to understand how a child's mind reacts to the boundary between consciousness and unconsciousness, and what these perceptions can reveal about the functioning of the psyche in the face of extreme risk. During one of the comparative analyses, Kübler-Ross observed that, among 38 accounts of pediatric patients studied, only 6 presented structured and non-fragmented descriptions. David's case was the most complete. He described the sequence of events linearly, remembering the hospital environment and the position of the professionals, as well as auditory and visual details compatible with the period when he was unconscious. Another point that drew attention was the absence of fear in all interviews. The child maintained a stable and peaceful discourse without anxiety or confusion. This characteristic contrasted with most cases of admission to the pediatric ICU, where fear and irritability usually persist weeks after discharge. The team concluded that, for David, the episode had transformed into a source of psychological comfort, which suggested a positive internal processing. Kübler-Ross highlighted this aspect in a report sent to the University of Chicago. In it, she described that experiences of extreme near-consciousness seemed to awaken in some patients a kind of emotional reorganization. It was not, she argued, a supernatural phenomenon, but a profound psychic response to contact with finiteness, especially when experienced without pain and without a perceptible threat. David, by reporting the presence of the angels of light, was not talking about judgment or fear, but about acceptance. During a home visit carried out in March 1978, Kübler-Ross observed the boy again, now resuming his school activities. She found him sitting at a table, drawing. He showed the doctor a sheet on which there were human figures surrounded by luminous circles. When she asked who they were, he replied, "They are people when they are happy. They look like this before going to sleep." The observation was recorded in full. These manifestations reinforced the psychiatrist's hypothesis that the account had integrated into the boy's symbolic repertoire without generating cognitive distortions. It was, in clinical terms, a memory incorporated into the normality of the experience. This distinction for Kübler-Ross was centrally important. It meant that not every extreme experience translates into trauma. Some can, paradoxically, produce serenity and acceptance. Case 312A then began to be used as a comparative reference in the team's subsequent analyses. Within the academic structure of Chicago, it became a documented example of a child's account of lucid perception during a vital crisis, treated with medical rigor and observational language. In mid-1979, Case 312A was officially included in the second internal report of Elizabeth Kübler-Ross's team on experiences of consciousness in critical pediatric states. The document compiled statistical analyses, clinical comparisons, and medium-term follow-up studies. Although the publication did not mention names or identifiable details, David's case was described comprehensively, serving as an example of cognitive stability after an episode of cardiorespiratory arrest. The records indicated that the boy maintained normal school performance, adequate socialization, and absence of symptoms of post-hospitalization anxiety. His mother reported that he showed more sensitivity to the suffering of others and a curious tendency to comfort other hospitalized children during return appointments. Kübler-Ross described this change as precocious empathetic maturation, observing that contact with physical vulnerability seemed to broaden the boy's emotional perception without generating fear or withdrawal. During academic discussions, David's case provoked diverse reactions. Some of Kübler-Ross's colleagues with a strictly biomedical background questioned the validity of documenting subjective perceptions. They argued that experiences during cerebral hypoxia could not be taken as proof of preserved consciousness. The psychiatrist, however, insisted that the goal was not to prove metaphysical phenomena, but to understand the psychological and neurological impact of the borderline experience. She defended that the clinical record of subjective experiences was a legitimate part of scientific observation, as long as it was conducted with rigor and neutrality. In the qualitative analysis report, Kübler-Ross described David's case as an example of continuous perception in the context of temporary life suspension. The term life suspension was adopted to avoid philosophical or religious implications. The text emphasized that in some patients there was an impression of continuity of consciousness, accompanied by sensations of peace, intense light, and the presence of human or luminous figures. The common denominator, according to the doctor, was the absence of fear and the predominance of positive emotions. David's data were cross-referenced with 5 other pediatric cases with similar characteristics. In 4 of them, the children also reported the presence of luminous people, or friends of light. Kübler-Ross considered that such descriptions could reflect internal representations of perceived security in the resuscitation environment, the intense light of the rooms, the synchronized movement of the professionals, the feeling of relief after the return of the senses. Even so, she recognized that the coherence and serenity of the narratives defied simplistic explanations. The case gained relevance not only for its theoretical implications, but also for its human dimension. In a lecture at the University of Chicago, Kübler-Ross cited David's account without identifying the patient, referring to him as the boy who saw the silent helpers. She explained that, regardless of the origin of the experience, the psychological effect was undeniable. The child did not return frightened, but strengthened. What this teaches us is that there is something in human perception that surpasses trauma and finds meaning even at the limit of consciousness. This sentence, later included in a collection of texts on hospital psychology, summarized the central point of her approach. David's case, although kept confidential, became a symbol of a clinical stance focused on careful observation and respect for the subjectivity of patients, especially children facing extreme situations. In the early 1980s, clinical follow-up of David continued with semi-annual visits. He was now 14, attending middle school, and had stable cardiac conditions after a new surgical intervention. The psychological follow-up consultations, conducted according to the protocol developed by Elizabeth Kübler-Ross, sought to identify possible long-term cognitive and emotional changes associated with the experience lived years earlier. The observations indicated a pattern of emotional maturity above the average for his age group. David reported recurring dreams with intense light, but described them with tranquility and without a negative emotional charge. He said that, when he felt nervous or tired, he remembered the white moment, an expression he used to refer to the sensation of calm experienced during the cardiac arrest. According to the 1982 report, this memory functioned as an internal self-regulation resource, something similar to a spontaneous relaxation technique. Kübler-Ross's team observed that in pediatric patients who reported similar perceptions, there was a recurring phenomenon, the strengthening of resilience and empathy. Instead of developing a fear of hospitals, David showed interest in medical practices and said he wanted to help people wake up again. This type of attitude, interpreted within the field of developmental psychology, was described by Kübler-Ross as a post-crisis effect of positive emotional reorganization. During the home visit carried out in 1983, Kübler-Ross also spoke with his parents. His mother reported that her son had become more observant and calm, maintaining a behavior that she described as constant kindness. His father, initially skeptical of the psychological interpretations, admitted that the episode had changed the family dynamic. He said that the boy seemed to understand difficulties more maturely than adults. These accounts were integrated into the clinical dossier and served as the basis for a restricted publication aimed at mental health professionals. The text presented David's case as an example of healthy integration of a borderline experience, emphasizing the importance of psychological follow-up not only to prevent trauma, but also to enhance positive aspects resulting from the experience. In a marginal note in her research diary, Kübler-Ross wrote that the boy does not romanticize what he lived. He just understands it as something that taught him not to be afraid. This observation summarized a central point of her approach, recognizing the therapeutic value of profound experiences without turning them into doctrine or belief. For her, the role of the health professional was to receive the account with respect, analyze it with rigor, and allow the patient to integrate the meaning functionally into their own history. In the following years, the case continued to be cited in seminars and study groups on consciousness in critical situations. Despite advances in neuroscience research, no definitive explanation managed to encompass the totality of the phenomena reported by David. Kübler-Ross, always cautious, maintained the same position. The episode was a legitimate clinical record of perception during a vital crisis, whose relevance lay less in the origin of the phenomenon and more in its effects on human behavior. David's story thus remained as a rare example of balance between scientific observation and clinical sensitivity. For Kübler-Ross, this balance was what distinguished the medicine that only prolongs life from the medicine that understands the experience of being alive. In 1984, the consolidated results of the study conducted by Elizabeth Kübler-Ross on perceptions in critical pediatric states were presented at a medical symposium held in San Diego. David's case, identified only as pediatric patient 312A, figured among the central examples. The complete report included clinical descriptions, physiological data, psychological notes, and transcribed interview excerpts with the family's authorization. The presentation's goal was to highlight the importance of integrating subjective observations into hospital follow-up, especially in pediatric intensive care units. Kübler-Ross argued that the perceptions reported by children during episodes of unconsciousness should not be treated as delirium, but as legitimate expressions of psychic experience. She insisted that the doctor's role was to listen with neutrality and record with precision without seeking religious interpretations or physiological reductionism. The presentation aroused interest and, at the same time, resistance. Part of the medical community viewed the inclusion of subjective accounts in clinical publications with caution, fearing that they might be misinterpreted outside the scientific context. Other professionals, especially hospital psychologists and nurses, recognized the human and therapeutic value of the approach. Several of them reported similar situations in which children described after resuscitations intense lights, tranquilizing voices, or familiar figures who seemed to transmit security. Kübler-Ross maintained her cautious stance. In her text, Clinical Observations in Borderline States of Consciousness, published in 1985 in an academic journal of medical psychology, she reinforced that such phenomena should not be classified as metaphysical evidence, but rather as reports of perceptive experiences during extreme conditions of the human organism. David's case was cited as an example of healthy processing due to the way the boy incorporated the experience into his daily life without presenting emotional imbalances. In the same year, the hospital implemented an experimental protocol for psychological support for children undergoing complex cardiac surgeries. The model included active listening to spontaneous accounts, partially inspired by the guidelines proposed by Kübler-Ross. Although without public mention of David's case, the new protocol reflected, in part, the lessons learned from his experience. Over time, other professionals became interested in the longitudinal analysis of the case. At a conference at the University of Minnesota, a researcher in the area of neuropsychology presented studies of cerebral blood flow in patients with episodes of cardiac arrest, suggesting that consciousness might maintain residual activity even after the interruption of vital signs. Kübler-Ross followed these discussions with interest, but always reinforced that, although the mechanisms were studied by science, the human meaning of the experiences remained an open field. Case 312. A thus remained a reference for good clinical and ethical practice. More than an isolated account, it represented a meeting point between medicine, psychology, and humanized care. For the students and professionals who worked alongside Kübler-Ross, it became a constant reminder that listening to the patient, even when science does not yet explain everything, is an essential part of the art of caring. At the end of the 1980s, the case of the boy identified as David remained archived at the Elizabeth Kübler-Ross Foundation as one of the most complete examples of a child's clinical account of perception during a vital crisis. The observations accumulated over nearly 10 years had allowed the team to follow the patient's developmental trajectory up to adolescence, recording data that would later be used in training programs in hospital psychology. In a 1989 review, Kübler-Ross re-examined the original notes of Case 312A. She wrote that the account of the boy in room 12 continues to remind us that there are human phenomena that demand listening before explanation. This phrase would be cited countless times in courses and lectures on psychological care in intensive care units. The episode had ceased to be just a medical curiosity to become a landmark in the ethical and humanistic reflection of clinical practice. At that time, David, then 19, sent a letter to the hospital thanking the team. He wrote that he intended to study nursing and that the experience in childhood had taught him to value human care. He briefly mentioned what he called the Friends of Light, saying that, although he had never seen them again, he sometimes felt the same calm when helping someone not to be afraid. Kübler-Ross kept the letter in her personal files, considering it the symbolic closure of the follow-up. Over the years, the case continued to be cited in international congresses on health psychology and experiences of consciousness in critical situations. Even without names or identifiable data, the clinical details and the psychological consistency of the account became a reference for the scientific study of near-death experiences, known by the acronym NDEs. Kübler-Ross insisted that the term should be understood within its medical context and not as an assertion of belief. For her, the value of David's case resided in the emotional response that followed the episode: serenity, empathy, and absence of trauma. In her later publications, the psychiatrist reaffirmed that experiences like David's could not be reduced to hallucinations or interpreted as religious phenomena, but deserve to be recognized as authentic human experiences. The scientific attitude, she argued, should balance observation, neutrality, and respect. The case of the boy in room 12 had demonstrated that careful listening could transform a subjective account into an instrument for clinical learning. After the passing of Elizabeth Kübler-Ross in 2004, her archives were preserved and digitized by the foundation named after her. Among them remain the original reports, marginal notes, and the transcription of the first interview with David, handwritten on hospital paper yellowed by time. The document continues to be consulted by researchers interested in understanding how the human brain and mind respond to the boundary between life and unconsciousness. Decades later, the case is still studied not only for its content, but for the method with which it was conducted. The technical rigor, the absence of judgment, and the absolute respect for the patient's account made the episode a paradigm of medical ethics. The story of the boy who recognized the angels in the hospital remains, even today, a reminder that clinical practice is also made up of silence, listening, and humility in the face of what science is still learning to name.